Hello, I'm Dr. Martin Bales here at the Center for New Medicine and Cancer Center for Healing, and today I'm going to talk a little bit about light therapy. What is light therapy? Well, let's go do a little history first. They've been researching light therapy since the late 50s, early 60s, and it's using light, which are called photons or packets of light, to treat humans and animals. And they found, even way back in the 60s, that the benefits were incredible with minimal side effects, very low risk. Using these photons or packets of light stimulates biological processes in the body. We all know that we're made up of trillions and trillions of cells, and it turns out that different wavelengths or colors of light stimulate different cells to perform their duties better, and also to perform cellular detox, which is ever important in today's environment. The future of light therapy looks very bright. Okay, that is a pun intended. They actually now published in Frontiers in Neuroscience a couple years ago, researchers in Australia were using high-powered lasers with actually less power than our Firefly equipment here at the center to stimulate neurons in the brain for neurocog disorders such as dementia, Alzheimer's, and even into multiple sclerosis and Parkinson's, ALS, which is Lou Gehrig's disease. And I have treated a handful of patients here with memory disorders, usually diagnosed with dementia, with success, and also with Parkinson's. So it's a new frontier for us. We're able to do what we couldn't do just a couple years ago because of the power level. We're actually able to permeate the skull with the near-infrared light to get energy into the brain. There are many different kinds of light therapies based on different wavelengths or colors of light. Here at the Center for New Medicine, we employ the use of near-infrared, red, and blue in our device called the Firefly, and also far-infrared, which is a little bit different than near-infrared, in our infrared saunas, which promote detox. The basic principles is that the different wavelengths or colors permeate to different depths. The blue, for example, is really good for superficial. It doesn't permeate very much, so it's good for wound healing, burns, cuts, contusions, and also for lymph drainage because most of the lymph nodes are quite close to the surface. The red color is good for permeation up to about 1 inch. So it's good for subdermal or subskin healing, injuries that are relatively superficial, and also for promoting blood circulation. The near infrared at our power levels permeates up to 20 centimeters, which is about 8 inches. It does not go through bone, but in soft tissue, it'll permeate to that depth. So the usage of all three simultaneously is very beneficial because we're hitting all the different levels. Now, going back to the cell, we are composed of trillions and trillions of cells. And inside each cell, there's what's called the mitochondria. It's like the little, I call it the little nuclear power plant inside the cell. And it was found that the infrared wavelength or color of light actually stimulates that mitochondria. So it stimulates the mitochondria to create more energy, which is called ATP. It's a molecule that's basically the energy currency of any mammal. By creating more ATP, we put more energy into the patient's system, allowing the body to do tasks that maybe it couldn't do before due to an injury better, also to promote healing, to promote detox, and just promote a general feeling of well-being, which is usually in the healing process. Using all three lights, the blue, red, and infrared, greatly increases the efficacy of light therapy. And I've witnessed in my over 11 and a half years of working here at the center, I used to just use infrared light at a very low power level. I've since added red and blue light with the Firefly device and found out that simultaneously using them not only decreases the treatment time, because treatment times before were up to half an hour and we're down to 5 or 10 minutes now, but also increase the efficacy. What took me maybe 5 or 6 sessions before, I'm seeing in 1 or 2. And that's beneficial for me. I can see more patients, and also obviously for the patients have to come in less time to see me. Most of my patients witness results in only one treatment, one 10-minute treatment with light therapy. However, with some chronic cases, and chronic is a disease process that has gone on for more than 6 months, it may take 2 or 3 sessions to notice some improvement. The beauty for myself of working in a center like this is if I don't get results with light therapy, there's other modalities such as PEMF, pulse electromagnetic field, that can also be applied either by itself or simultaneously. Most patients see results within 3 treatments. During a typical light therapy session, which is up to 10 minutes, the patient just feels some warming sensation. The light is emitted through 2 different wands, which are, I call, painted over the surface of the skin. remember, permeating in up to 8 inches in the area of concern or injury. Just some warmth is felt during the treatment session as the wands are continuously moved. We don't keep a wand in any specific location for too long, as it could burn the patient. When using light therapy at the power levels we are here at the center, there can be side effects, and to be careful to administer a proper dosage of the light therapy. If a dosage exceeds the person's ability to absorb that amount of wavelengths of colors of light, then the patient can experience temporarily pain, perhaps some vertigo, because we're stimulating blood circulation to an area for perhaps 1 or 2 days. There have been no known permanent side effects from light therapy. Light therapy is appropriate for any soft tissue kind of an injury. As I mentioned, superficial burns, cuts, contusions, tears, sprains, strains, any of those are usually more acute. Any kind of chronic pain, such from like perhaps a motor vehicle accident or sports or martial arts injury, down to any kind of chronic condition perhaps initiated by an exogenous source. For example, neuropathy, and we see a lot of chemotherapy-induced neuropathy. So where the nerves are damaged due to a chemical, or to, say, in diabetics, high sugar levels, we see a lot of diabetic neuropathy. Those two neuropathies happen to be very easy to treat with our light therapy here at the center. I've also seen neuropathy such in the feet and hands that were a result of nerve impingements, or what's called radiculopathies, in the neck and the low back. And what has happened, and this is over a series of probably 10 or 20 years, there's been a nerve impingement in, let's say, the low back, which has decreased the blood circulation to the lower extremities. And over time, the nerves haven't been nourished, and the soft tissue hasn't gotten the correct blood circulation, and the nerves have been deteriorated, which leads to a neuropathic condition. All of those are able to be reversed with light therapy. The other advantage is using light therapy to destroy pathogens. And we're doing that with our Firefly light therapy system here by running what's called resonant frequencies through the light and destroying pathogens, usually gut pathogens, bugs, bacteria, viruses, parasites, those in the patient's gut. And we've had reports of patients actually passing these pathogens after treatment, which is quite amazing, and leads me to believe it's not placebo, because I don't think you can tell somebody they're going to pass something and they do. So both the neurocog and pathogen ablation are 2 new frontiers for light therapy that we're very excited to delve into and explore here at the center. Okay, I think that wraps up the summary of light therapy here at Center for New Medicine. I hope you enjoyed watching. If you have any questions or comments, just read the comments below this video on YouTube, and that'll have information on how to get a hold of me if you have specific questions on light therapy. Thank you and have a great day.